very much for inviting me. I'm from what's called the Public Implementation Group. I'm here to talk about public involvement based at the University of Kent. Julian was just going to say something about whether it's useful or not useful.
Yeah, well,
how it came about.
Yeah, I'm not going to talk to you entirely, but just to reflect on our experience from a QORU perspective. QORU is our research in quality and outcomes. Jennifer's got a couple of slides to show us. And for us, this public involvement resource has been a fantastic resource for us in terms of being able to input into how we design, conduct, undertake and disseminate our research. Although I think we've still got a lot of learning to do and how to make the best use of this resource, it's a great thing that we're able to do it. And I want to thank Jennifer and all her colleagues on the PIIGS for the sterling work that they've been doing.
Oh, thank you, thank you. I said he could say nice things about me to start with, and then at the end, if he wants to retract it, that's absolutely fine. He can do that in private. So this links in quite nicely. I didn't realise what this session was about, but it does link in quite nicely, having heard especially George's presentation. I particularly liked what she said about the clever people, you lot, and then those other people out there. Well, I'm here to talk about those other people out there, the not so clever people, perhaps clever in different ways. And that's what public involvement is. And I'm aware you're from all around the world, aren't you? So I don't know what your public involvement is. We used to call it here patient involvement, so patient, public. We now call it public involvement. There's political, social reasons why we do that.
Excuse me.
Yeah.
Can I ask you to speak a little bit slow?
Oh, sorry, yeah. I was actually trying to compete with George, and I thought I couldn't possibly speak as quickly as that. So, yes, I will. I thought I was a very slow speaker in comparison, so I shall do, yeah. Can you hear me okay? Yeah. Okay, so I won't tell you about QORU, because I think you've had a few presentations from them, haven't you? Yeah? But a couple of things that are important. This is the mission statement, because everyone has to have one. To improve the quality and health and social care of people with long-term conditions through high-quality evidence, quality and outcomes of person-centred care. So patient public involvement would look rather strange if it was neglected, and centre whose mission statement is that. And luckily it isn't neglected, far from it. This is a sort of A to Z, if you like, and I've got lots of P's. And the first is the principles and policies taken from QORU. I won't bother to read them out, but you'll see the one in bold is that to ensure patient and service user involvement in the research and the public. Just to say something about this public patient, because you'll hear it called service user involvement, you'll hear it called public involvement, you'll hear it called patient involvement. Generically, we call it public involvement, and that does include carers and service users and indeed patients. And that's because, especially the work you're doing, isn't just about people who use NHS services or health services. It's social care, it might be carers, there's all sorts of other people, and indeed it's taxpayers, and all those have a stake in your work, so should be consulted and represented. So here's a P and an I. For QORU, achieve high-quality research reflecting the priorities of the public whilst achieving the ultimate goal of ensuring improved health and social care. PPI, raising awareness and helping to improve the understanding of the unit's work. And that's where I hadn't really thought about it before, but it does link in quite nicely with this knowledge transfer idea. I mean, traditionally, I'll tell you what public involvement is as we've been doing it, but I think one of the ways in which we can extend it and develop it, and you can, hopefully, you might be well ahead of us in your countries, but one of the things we're not very good at is actually using members of the public to disseminate results and actually get the message across. And certainly patient network groups, carer network groups, and all sorts of other public venues. If somebody who's a user of the service stands up, sometimes it has a little bit more power, and also perhaps it cuts through some of that cleverness that George referred to. And PPI should be seen throughout QORU, and indeed it is. So for you, for researchers, just incidentally, who's doing it now, if you know what I mean by doing it? And where are you from?
Australia.
Australia, yeah, you would be. I hear you're well ahead of us in all sorts of respects. Anyone else? Public involvement, patient involvement in any other countries? Italy, yeah? Yeah. Is it going well? Does it help? Yeah, some and some, yeah.
Public involvement is quite difficult.
Is it?
Yeah.
Oh dear. Well, learn from us. I'm sorry to hear. I'm sorry to hear you. I'm sorry to hear that. Okay. Well, yes. If in case I forget to say, if anyone needs any information afterwards, please do email us. If you can learn anything or we can share anything in the spirit of sharing things. So what we do in the team at QORU is very practical things. We comment on research funding, ethics applications, research protocols, study documents. So the typical scenario would be that you've got a public patient information sheet and it looks okay to you. And I always say to people, well, give it to somebody else. And then I look at it and I think, well, who have you given it to? And they say, well, I gave it to my colleague in the office. Well, by somebody else, we usually mean somebody outside the office, okay? Not a researcher, because obviously they're going to understand it in the way you understand it. So you get members of the public, patients, carers, service users, to look at concrete things like consent forms and participant information sheets. And sometimes they'll say things that, can't be done or that you don't think are relevant, and that's absolutely fine. But it's a tool. The whole public involvement is a tool for you to use in order to help your research, A, get better, and B, have more impact. Lay summaries, we can write them, we can adapt them. The publicity material, so that's at the end of a study, as I say, in terms of knowledge exchange. I love all these words. I've learned all sorts of new phrases. I didn't know there was such a thing as a knowledge exchange. I work with someone who's called a knowledge broker, and I ask him quite a lot what he does, and he's got absolutely no idea, but it sounds great, doesn't it? Knowledge broker. I come from a philosophical background, and to us, knowledge is like something dropped down from God. Nobody ever sees it, so I love the idea that someone can actually broker it. That's quite amazing. But the other thing in terms of publicity materials are your recruitment adverts. So if you're trying to recruit participants for a particular study, we can advise you on what they look like, what might engage us, where to put them, and where perhaps not to put them. And some of the things that I've been involved with, I just remember sitting as a patient in the neurology hospital that you mentioned earlier, and I was waiting for an appointment, and then a researcher stood up and said, are there any epileptics in the room? Because I'm doing this study, and if you'd like to come and see me. And I was thinking, right, okay, so if that had come to perhaps patients or even members of the public, or probably everyone in here, I'm not saying you would make those mistakes, but to her that was perfectly reasonable. And it had been through ethics, it had got approval. So, these safeguards that we think are there, and I sit on an ethics committee, and I work for the National Research Ethics Service, training ethics committee members, so you'd think that by the time it's gone through all that, and indeed the funding committees, that wouldn't happen, and yet it does happen. And that might be partly because what you say on paper and what you do in practice are two different things, and I'm afraid in some senses we have little influence over that, but that's again an area that you could develop, because we can also become involved in recruiting participants. Sometimes it's easier for somebody to say yes to someone who looks like them, who's been through the same experience or whatever, than it does an academic researcher, and partly that's goes back to George's Mr. Men, Mr. Clever, and they're more likely to say yes. Advisory groups, it's just about getting different people in a room, as we've been speaking. I won't say too much about that. In terms of disseminating the findings, we need to be quite creative about this, because there are things like going out to organisations, giving talks, through local networks, all that stuff. We can also, it rather depends on the skills and experience of the members of the public, but I write for the press as well, so if you get someone who can write for the press, we can help with that, and we can be a champion for your study through the press. Or perhaps we could do conference presentations, we can co-author journal articles. Now these are things that, you know, small steps, and some people may need training, they may need, you know, help, whatever, all sorts of things that you can put in place, but that's not a reason not to do it. It's a reason to try it and see if it helps, because sometimes it does. Again, reading a journal article, if I saw a journal article and it was about health and social care for older adults, and one of them was someone who'd cared for their father and talked a bit about that and how that research would help them, I might be more inclined to think that it could have a real impact. And I'm sure I'm not alone in that. And then practically, we could also be involved in undertaking things like qualitative interviews with research participants. Again, it partly depends on the skills of the people, and it partly depends on your willingness and your openness. And it's really about you deciding what you want and what would best help you, and being creative about it, and then finding the people to do it. So what we've done at QORU is we established, this is why this is called Pigs and Ducks, by the way, because I don't know where the ducks came from, I didn't put that in, no idea who the ducks are, but we're euphemistically known as the pigs because it's the public, God, is it a PII? Public Involvement Implementation Group, okay, yeah, there's far too many acronyms. So we developed this group of which I'm a part, and we oversee and monitor the implementation of the public involvement strategy. I work in public involvement across a lot of universities, and I have to say that, you know, it's the best example, and we've shared our experiences and our hard times and our good times with other universities and other centres. And it really is something to be proud of. So thank you very much to all of you who've supported us. We have 25 research advisors, is what we call them, members of the public, working across England to support individual research projects. Some are better than others, some are more useful than others, and, you know, that's fine. It doesn't all have to be perfect.
Excuse me, what do you mean by lay research advisors?
Well, they're members of the public, so they're not academic. So, I mean, we have, what do you call it? Yeah, exactly. We could spend a whole day on it. Does it matter?
Yeah.
It doesn't matter. What matters is that they're not part of your, I mean, they are part of your research team. Well, they're not salaried academics working in your department as a whatever it is you are. Does that make sense?
Yeah.
You know. So it doesn't really matter what the definition is. I mean, we could do semantics, we could talk about it all day. We've got 5 researchers and 5 members of the public who sit on the group, of which there are some in here, and we share ideas, we have arguments, we have a bit of sulking, we have lots of nice lunch, and at the end of it we come out with something which helps your studies, which is great. And the people are patients, service users, carers, and everybody has to have, I don't know what it says, and/or, hopefully they all do, they wouldn't be there, have an interest in health and social care, and in particular in long-term conditions. So what have we been up to? Okay, thank you. Look, this payment thing, I don't know whether any of you have had experience in your countries of finding this a bit difficult, but I mean, you know, again, we could talk till the cows go home about should you, shouldn't you pay, how do you pay, and all that stuff. We've solved it. I don't know how. Very clever people in the office somewhere had lots of blood pressure raising moments and came up with something. And we're now using it, and we're sharing it with all sorts of other universities who are going through the same thing. So that's brilliant. We've got our research advisors, we monitor things, we do some training for researchers, because some new researchers, no, I shouldn't say that, some researchers, because it's often actually the older, more senior researchers, so I shouldn't say new. The new researchers are fine, they're fantastic. No, they're not. It's just individuals, isn't it? Some researchers are very reluctant, probably they've had their fingers burnt, and I can imagine they've been down your road, or they just don't see the value of it. And sometimes perhaps there isn't. And in here, your techie LSE, what I call techie number thing, all this stuff I don't understand, loads of numbers, all very complicated, then it's difficult, isn't it, to see where we might be able to help, because it's all so complicated, all loads of numbers and graphs and all that sort of stuff. But those numbers and graphs in your work, long-term conditions, in health and social care, if it's got no point to it, it comes back to this, what's the point? If those numbers and graphs don't translate into anything that's going to help anybody, what are you doing it for? You shouldn't be doing it, I don't think. So at some stage, somebody outside the people who can understand those things will have an interest in and should be involved in that to try and translate that very complicated thing into language that we can understand that people can hopefully use. That makes sense. I mean, having said that, I do sit on a couple of those things and I think, you know, it just goes completely over my head and flies out the window. But occasionally, I sit on the funding panels for the NIHR, and we have very technical stuff coming in. And one of the ones that I sit on is well outside your field, but it's the invention panel. So you have incredibly clever engineers coming who've invented something. They've invented a sprocket or whatever you call it to work in surgery. And once we sat there and somebody came in and they were really brilliant. They've made these glasses to help blind people see. I euphemistically call them glasses, but they're actually things to help blind people see. They're much more clever than glasses. And they'd done all this work and it was brilliant. And I sat there thinking, well, I know it's a really naive question, but I'm going to ask it anyway. We're the masters of naive questions. And I put my hand up and I said, but my father, who's going blind, if he's upstairs in the bathroom and he's left them downstairs in the kitchen, how's he going to find them? Well, he goes downstairs and he finds them in the kitchen. And I said, yeah, but he's blind, isn't he? Which is why he needs them. Ah! Yeah, but they work with this, and this, and they've got this all, a sprocket, and graphs, and numbers, and it's all economics. Yeah, but how's he going to find them? Ah! So anyway, so I'm glad to say that a couple of weeks ago, you may have read about this, I read about it in the press, that they've actually launched them now. And the easy thing that they did to solve that was put a little buzzery thing in. You know, but it wasn't, I mean, I'm not saying it would have only been me, could have only been me, but sometimes I think fellow researchers get a little bit embarrassed to ask really stupid questions, and I have no problem. Let's just see if there's anything else that's really, I apologise for not getting through this, but we've done 22 projects, 12-month period, all sorts of things, proms, usual sort of story. We're developing all the time. If you've got any ideas for us, please get in touch. If you've got any questions for us, please get in touch. Don't worry if you stumble and fall and, you know, have bad times with people. That's the nature of the business. Doesn't matter at all. Keep going. And our details are on there. Thank you very much.